Welcome back to the show, everybody. Great to be here with you. Today, we're going to be talking about the pros and cons of TRT, or testosterone replacement therapy, for both men and women. So I don't know about you, but it seems at least half of the men that I speak with are on TRT. So either there is an epidemic right now of men and low testosterone, or we have far more doctors prescribing testosterone, maybe whether men need it or not. And unfortunately, I believe it to be the latter. And here's why. When you look at the men that are on testosterone right now, we are not talking about 65, 75-year-old men. We are talking about men in their 20s, 30s, and 40s, which is way too young to be using testosterone replacement. I want to share with you why right now, but then give you the pros and cons, because there are benefits. There's no doubt about it. And one thing I like to talk about on this show is always the truth from an unbiased perspective. And that's exactly what you're going to get. There's a time and place for everything. But when you are a male and you have low testosterone in your 20s, 30s, or 40s, I can tell you for sure it means that there is an imbalance in your body that needs to be corrected. Because if you don't correct it, it's going to end up as a chronic health condition in 5 to 10 years, most likely. And we have over 300,000 lab tests to show that. So if you have low testosterone, I have lots of shows on it, so I'm going to link them up here today at stevencabral.com/3737. And I'll give you the reasons why men have low testosterone. But you're dealing with a chronic inflammatory issue, an issue with nutrient deficiencies, an antioxidant-based issue. You're looking at potentially toxicity like heavy metals or something else that's causing oxidative stress, or a sleep issue that you are not correcting that is and probably will lead to high blood pressure, heart disease, and maybe even type 2 diabetes from an increase in elevated blood glucose. And none of that goes away, by the way, by taking testosterone. So by taking testosterone, you get the physiological and psychological benefits, which are the pros, and I'll talk about those in a second, but you mask and band-aid what was going on in the first place that caused your low testosterone in your 20s, 30s, and 40s. Now, again, if I was sick when I was 19 years old and was getting tested, right, for all my health issues, I would have been put on TRT. My testosterone was in the tank. Why though? Well, I had massive other health issues. I had an autoimmune issue. I had Addison's disease. I had crazy insomnia. I had type 2 diabetes. So there were reasons why my testosterone was so low. If I was put on TRT, what would it do? It would increase my testosterone. Would it fix anything else? No. And ultimately, it would have made them worse because I would have overlooked them and allowed them to fester. That rain barrel would continue to have overflowed. And that is why I'm so concerned with this willy-nilly attitude about prescribing hormones. Hormones are very powerful. And please keep in mind that most doctors are not giving a physiological dose of testosterone. And I know this from running tens of thousands of stress, mood, and metabolism tests, which looks at all your hormones, cortisol, thyroid, vitamin D3, etc. So here's the issue. A healthy dose of testosterone, free testosterone, which is the only thing that matters, by the way, only thing that matters. And most doctors are looking at total testosterone only, but that's another story. Free testosterone for men should be about 100 to 150. As you get older, it might drop 70 to 100 when you're in your 50s to 60s. Still can be normal. Depends on your symptoms, right? Not everybody needs to go on TRT. Here's the thing though. When I test men and they're on TRT, their levels are not usually between 100 and 150. They are 250, 300, 375. That is called a super physiological dose. That is when there are real serious side effects. Not today, not tomorrow, but in potentially the next few years, which we'll talk about. A normal dose of testosterone, when you need it and you've worked on the underlying root cause imbalances, can allow you then to maintain a lot of the youth that you do want. We'll talk about that as well. So a If you are going to use testosterone replacement therapy, not medical advice or medical treatment plan, the best way to do it is a small daily injection. Or you could use a cream or pellets, but pellets aren't the best. Cream, hard to standardize. Injection, you know what you're going to get. The daily, because your body increases testosterone on a daily basis and then it drops as well. So that is the biggest issue with testosterone replacement therapy, is that it's never truly like natural testosterone. People say, oh, it just replaces your own natural levels. It does not. Okay, it does not. And here's why. Most men are taking, and women, a once-a-week dose. That is a massive dose that falls over the course of a week, but it stays elevated 24 hours a day. Natural testosterone rises in the morning. It falls a little bit. It may rise again mid-afternoon and fall again. That is normal and natural. You're on testosterone, it is high all the time, which is why it can lead to side effects. Let's go over now a lot of the pros and cons. The idea behind using testosterone is to improve your overall energy, your muscle mass, your mood, and your libido. That is, I would say those are the main reasons people use it. Some people use it for recovery. Some people use it for, maybe they've heard there's some anti-aging based benefits. Certainly it can help with bone. That's something that is very important as well. But the main reasons that most of the clients I work with, they'd say, oh, they started it because of they wanted to improve their low mood, low energy, low libido, and just put on more muscle. Totally get it, right? Okay. So we've got that. We've talked about how you can actually inject it in the safest way. So if you are using it, if your current doctor will not allow you to do it on a daily basis, as the human body would get a small amount every day instead of a megadose, just like that's the way that nutritional supplements should work as well. A little bit every day, not a megadose once a week. Okay, that's a much, much better way to do it. All right, so here's what I want to share. The biggest improvements you will get using testosterone replacement therapy in the healthy way. Now, you know now how to take it on a healthy way, but the most important thing is that after 4 weeks of being on it, run the stress, mood, and metabolism test again, or at least run your free testosterone with your doctor. Look at your number. Is it between 100 and 150, or is it above 200? If it's above 200, you need to dial down the dose. That's the important way to do it, right? So really important is that you retest after being on it. I'm going to give you a few more labs that are really important to run before you ever get on testosterone if you haven't started yet. So we talked about the increased energy and vitality, the muscle mass and strength, the better libido and overall sexual function, the mood and cognitive benefits, the bone density. There are cons though, and doctors never talk with you about the cons. And I understand that they're getting paid hundreds of dollars per month per patient, usually, when someone's on testosterone. I don't think that that is a good idea or business model, and it should not help you sleep at night, right? Like that should be a bad thing. Whether it's a pharmaceutical, a supplement, a health biohack, it should only be used by the person who needs it, right? Like that's the thing. And you want to do everything to work on the underlying root cause. So 20s, 30s, and 40s, you better believe you have done at least 6 months to 9 months of working on improving the gut, getting rid of the heavy metals, improving your sleep, dialing in your nutrient deficiencies. You have to do all the things first to get back your own natural testosterone, because why wouldn't you want that? Because there can be cons to it. The first con is this. The first con is this. It can shut down your own natural production, and it will. Very simple and straightforward. A lot of people think when they take melatonin, it stops your own melatonin production. It does not. Melatonin is produced through light and dark signals on the pineal gland. It's different. With our hormones, if we give a hormone above the level that our body would produce on a daily basis, there's a feedback loop. The body then says, oh, we don't need, tells the hypothalamus, to tell the pituitary gland, to tell the testes, that we don't need any more testosterone produced, right? So like, okay, then no more is being produced. So it shuts down your own natural production. I will talk about next week how to get back your own natural production. A lot of people think, oh, you'll just get it back in 2 to 3 months from stopping. Okay, Many men do. The older you get, the harder it is. And it can take many men 6 to 12 months, with some men over 2 years to get back their natural production of testosterone. So don't think that you can just get on it and get off of it. The second is this: if you are looking to have children, my opinion, you should not be on testosterone replacement therapy. It can make you infertile and reduce sperm production. Really important. So again, big factor. And are doctors telling guys in their 20s and 30s this, or even 40s, right? Like, are they telling them that this could affect fertility? Many don't. And they come to me saying, I need to get back my own natural testosterone production. I need to improve my sperm quality, guys in their 40s. And I'm saying, yeah, we're going to make this happen. But like, your doctor should have told you that. You've been on this for a decade, right? Like, this is not good, but we're going to make it work. We're going to fix it. Next week, I'm going to share with you how to. The next one is this: potential cardiovascular concerns. So, is everyone who takes testosterone replacement therapy going to get an increase in hematocrit and thickening of the blood? Not everyone. Is everyone going to get increased levels of low density lipoprotein, LDL, like the bad cholesterol, right? Or increase in ApoB? Not everyone. Are some? Yes. And again, I have the labs to prove it. This isn't just me. Many men end up having to give blood every quarter or so because their blood gets so thick. That is a dangerous thing for heart attacks, potentially strokes, cardiovascular issues. And their inflammatory cholesterol can increase. So it's at least something to take into consideration. And before you get worried, I'm going to share with you some labs to run before you go on. The fourth one is this: when you increase testosterone, directly below testosterone is estradiol and the other two forms of estrogen, estrone and estriol. Testosterone, when given in excess, especially for certain individuals, will ramp up conversion of testosterone to dihydrotestosterone and the two forms of DHT, which could cause prostate swelling and inflammation. We'll talk about that. Usually it's a pre-existing condition, so I do want to be fair about that. Or it could cause hair loss. That's one as well. It could cause hair growth on the back or body hair, thickening of body hair. This goes for women as well. Deepening of the voice, thickening of the jawline or the bone above the eyebrows itself for both men and women. So all of these things are possibilities, right? Okay, but it can also convert to estrogen. And that estrogen could lead to gynecomastia in men or higher levels of estrogen in women, which could lead to other health-based concerns. So important to look at that. Water retention, mood swings, and as I spoke about before, gynecomastia, which is essentially breast tissue growing in men. The last one is this, and this is why I spoke about this. The risk, I spoke about the risks before. Again, the cancer risks, I think, are a little bit more overblown unless you're using more like steroid-based dosage. You're using high dosages, right? There is a bit with prostate-based cancer. If you have pre-existing prostate inflammation, elevated PSA, you want to be careful using testosterone replacement therapy. I think that's a wise one since it's a gray area right now. Okay, I had to mention that. But the bigger thing is this. If you started taking TRT for low testosterone in your 30s, 40s, 50s, it's just 20s, 30s, 40s, and even early 50s, I would say this. I mean, again, I don't plan to use myself in my 50s, but I can see some people, they may need it. I totally get it. Okay. It means that you overlooked a more serious health concern because there's no way the human body, especially as a male, but including female as well, should you have low testosterone in your 20s, 30s, early 40s. For women, all through your 40s for men. Why that's important is because if you go on it, you just overlooked your body sharing with you symptoms as to what is wrong, and those will now be masked. And if you never fix the underlying root cause imbalance, it could lead to much greater health concerns, especially as you get to your later 50s and 60s. And so that's what I wanted to mention. So my biggest concern is with younger men that I just spoke about, anyone under the age essentially of 55. I then start to look at it, but usually I'm only using DHEA in my practice as a hormone precursor and not TRT. Once men get into their mid-60s, then we start to look at, is this something that you would like to use or potentially benefit from. Now, there are circumstances for all individuals, and I'm not going to say that there are not. I totally get it. I mean, some men have testicular cancer. They no longer have testes. They're not producing testosterone. Like, remember, like, I'm just talking about general population because that's all I can really talk about. I can't talk about every contraindication. So what I want to do right now is I want to link up a previous show on the different reasons for low testosterone and how to boost your testosterone naturally. I'll do that by heading on over to stevencabral.com/3737. And of course, all the shows are completely free. And then what I want to do next week is talk about if you are on TRT, how to begin to wean off if you want to bring back your own natural testosterone levels, but you don't want to become depressed, low mood, low energy, etc. We'll work on all those items next week, but hopefully today's show was helpful. Again, there are benefits to testosterone replacement therapy, no doubt about it, but we can't forget the cons, the downsides, with the biggest one, if you started to take it early in life, why was it low in the first place? That is the question we always need to answer. Hopefully this was helpful. Again, all the show notes will be at stevencabral.com/3737. Feel free to share the show with anyone you believe it could serve. Take care, everybody.